Cleaning cages has similar steps to cleaning kennels. You must remove all soiled paper, water and food bowls, litter boxes, and toys. Wipe down the cages with cleaners using paper towels or clean rags that will be used only once before laundering again. Do not smear fecal material or food waste around the cage. Again, allow the disinfectant 10 minutes of contact time before rinsing it off the cage. If you do not use disposable kitty litter trays, you must be thorough about cleaning the tray. Do not shortcut this step by merely replacing the litter. Any remaining feces will cause odors and diseases to linger. Discard litter trays that have become quite scratched up from long use. These scratches can harbor germs. Water and feeding bowls must be washed and disinfected using your hospital's protocol. Without question, maintaining a clean kennel is vitally important to controlling the spread of disease. Equally important are the cleaning protocols that must be maintained in other areas of the veterinary hospital. These include the cleaning and disinfecting of counters and exam tables, the cleaning of commonly used instruments, and floor maintenance. Virtually any area contaminated by the presence of a sick pet needs to be cleaned and sanitized prior to another pet entering that area. This is especially evident in the exam room. As pets are placed onto exam tables, they are quite likely to leave behind saliva, hair, urine, blood, or feces. These items are possible carrying agents for disease-causing bacteria or viruses. Preventing the spread of disease involves both the physical removal of these contaminants and the killing of possible bacteria and viruses that may not be so readily apparent. There are many spray disinfectants that are commercially available that serve to kill or deactivate these disease-causing agents. Many of these are sold as concentrates and should be first properly diluted for most effective use. Careful measurement of these products is vital to their effectiveness. Between every patient placed on the exam table, a liberal spraying of a disinfectant should be applied to the table surface. It is best to allow several minutes of contact time prior to wiping, as this will more effectively kill the infecting agents. This is especially important when the previous patient is suspected of having a highly contagious disease, such as parvovirus. Between healthy patients, a reduced amount of contact time may be necessary. It is best to use only disposable products, such as paper towels, to wipe the disinfectants, hair, and other debris from the table. Wiping the surface in a manner similar to that being demonstrated will help to assure no debris or residue is left behind. The surface should appear 100% clean and free of all hair and other debris. Throw the paper towel in the trash. If surface contamination is still evident or suspected, a second disinfecting is called for. The adjacent counters and floor are often contaminated with hair or blood and will likewise require regular cleaning. Keeping the exam room and treatment area clean will not only help to prevent disease, but it will aid in controlling odors. A client bases much of their perception of your hospital on what they see and smell in the exam room. This is also the time when instruments and otoscope tips will need to be cleaned and disinfected. The tip of the otoscope is a likely source of bacteria, yeast organisms, or mites. If these tips are not thoroughly cleaned out, both inside and out, the next patient is at great risk of contracting the previous pet's ear problem. A cotton-tipped applicator or brush is often needed to clean out the inside of the tip. If these tips are soaked in a disinfectant between uses, pay special attention to regularly changing the disinfectant. Removing all physical debris prior to soaking is a must if true disinfecting of the instrument is to occur. Instruments that are used in the exam room may likewise have been contaminated with blood or solid debris and should be wiped clean or brushed clean with an instrument brush prior to being sterilized. The other area frequently infected by the presence of a sick pet is the floor. Blood, urine, and feces frequently spread disease when regular floor cleaning and disinfection protocols are not followed. Floor cleaning must occur more often than once a day if true disease prevention practices are to be achieved. Though every hospital should have a planned daily cleaning and disinfecting of the floors throughout the hospital, intermittent cleaning should occur as needed. Patients that are suspected of having a contagious disease, especially those of the digestive or respiratory tract, should not be allowed to walk freely through the hospital unless subsequent cleaning practices can be applied to every area occupied by the pet. Suspect patients are sometimes managed best by bringing them through a separate entrance or ushering them directly into an exam room where contamination of the floors can be limited. Mopping with a disinfectant is absolutely essential if infectious bacteria and viruses are to be eliminated before another animal walks through that same area. A dog stepping on contaminated floors, then licking their paws, may lead to a new infection. Blood, urine, and feces should be cleaned up immediately when these accidents occur. In addition to the physical removal of these waste products, be certain to use a spray disinfectant in the area where the accident occurred. Cleaning up an exam room or other floor area in the hospital will necessitate the physical removal of hair or nails with a broom or vacuum system prior to mopping. Hair, an unavoidable contaminant of every veterinary hospital, is not effectively picked up by mopping alone. Mopping will often only spread hair and other physical debris around. The most effective way of removing it is to vacuum it up. Mopping floors is a vital protocol in controlling disease. Such protocols should be defined by the hospital and followed with precision. The specific equipment and disinfectants selected for mopping vary greatly between hospitals. Your doctor or administrator have selected products effective at killing bacteria and viruses when used in proper concentrations. These products should be mixed fresh for maximum effectiveness. Clean mop heads are also important. Regular rinsing of these mop heads and keeping them in a clean, dry area will help prevent bacteria from growing on the mop head.